So, welcome everyone. It is really a great pleasure for me and honor from the team of Dr. Reddy for inviting me for today's platform. And I feel obliged to give my idea about the musculoskeletal system, its importance, and the related disease and related topics on the same subject. So, myself, Dr. Girish Motwani, I am basically a orthopedic surgeon practicing in the center of the India called Nagpur, and I'm practicing in Nagpur in the field of subspecialty of the orthopedics, which is called foot and ankle. So basically, I am the specialist of foot and ankle and the trauma specialty. Well, coming to the today's theme, that what is the importance of the musculoskeletal health. So as we all are aware that a musculoskeletal, this word itself contains the two things, which is called one is muscle and second is skeletal. And when the skeletal word it comes to our mind, we remember a bony model from a skull to the foot, containing and showing all the bones of the body. So musculoskeletal, basically it is musculoskeletal health. It play a key role to keep up a good mobility and a dexterity in an individual, along with the enhancing their ability to work and actively participate in all aspects of the life. It is a system which provides you the mobility. It is a system which provides you the posture, and it is crucial to maintain the economic, social, and the functional independence across their life course. So, physical activity has a crucial role in reducing the risk of many diseases related to the orthopedic issues and non-communicable diseases, and it can be only achieved with a good musculoskeletal health. The second thing is, what is the relationship between a painful musculoskeletal condition and how it reduces the physical capacity to engage in the physical activity. So anyway, if your musculoskeletal system is not working properly, it leads to the restriction to the mobility. It leads to the restriction of the functional abilities of the body, and it can lead to the acute and the chronic pain, which causes the physical limitation, and it imbalances your social, community, occupational activities and decreases the quality of the life. So impaired musculoskeletal system, orthopedic issues, pain in the limbs, difficulty in moving the limbs, myopathy, difficulty or weakness in the muscle, it leads to a lot of personal, community, and the social consequences, and finally it reduces your working efficiency. So strong relationship between the painful musculoskeletal conditions, lack of physical activity, and resulting functional decline, loss of well-being and loss of independence, as well as the depression symptoms. They has been described by several epidemiological studies in the standard literature and the journals. And individuals having a orthopedic arthritis or a joint pain, chronic conditions, is sure to be lesser active than the individual having no symptoms of arthritis. And a lack of the physical activity, it is one of the important prevalence risk factor which creates this problem. Most importantly, impaired musculoskeletal system causing the reduced physical capability, like a grip strength, like your posture balance, gait pattern, walking speed, chair rising, standing balances has been frequently linked to the increased mortality. So there are many long-term studies which say that a patient having a musculoskeletal problems in an early age group, they usually have less expectancy of the life, and the overall the duration and the morbidity of the diseases, they are more in the physically inactive patients, and thus a weak musculoskeletal health is a key component of frailty. So what is the impact of the impaired musculoskeletal health? So in short, I would say that a good musculoskeletal health is crucial for maintaining the active, productive, and the prolonged working life. With the increase in the global retirement age, maintaining the good musculoskeletal health will become increasingly important for older workers, as many occupation and the work-related activities are associated with the musculoskeletal disorder. Like many of them are having low back pain, chronic shoulder pain, chronic knee pain. And this is very important to identify and implement effective intervention for the people who are suffering from musculoskeletal problems. So high income countries, the well-developed countries, they observe musculoskeletal condition to be one of the major causes of work loss, early retirement, and lost retirement wealth. While developing countries like India, they see the musculoskeletal condition to have a major impact on the livelihoods. Thus, reduced musculoskeletal health, chronic orthopedic issues, they result in the reduced productivity and the economic loss to the society at all levels. Since the musculoskeletal conditions are painful, chronic, they are associated with the disabilities, inabilities to perform well, functional losses, social disengagements. Frequently, it causes a mental health impairment also, such as depression, anxiety, and the change in the behavior of or the psychological personality of the patients and other comorbidities also. So, physical and the mental health of a quality of the life related to the health is known to be greatly impacted in a person with a multi morbidity. Unfortunately, this impact is even greater when there is associated with the musculoskeletal conditions. What are the burden of the health disease related to the musculoskeletal conditions? So commonly in our practice, we see the chronic low back pain, chronic ankle pain, chronic leg pains, knee pain, shoulder pain related to the chronic osteoarthritis conditions, some inflammatory arthropathies, myopathies, and nerve problems like the neuropathies. And these all diseases, they affect some musculoskeletal behavior and for working efficiency and the functional disimpairment. So developed countries well recognize the transition of the burden to the long-term disabling conditions. However, now low to medium, middle income countries are also demonstrating the enormous future impact from the musculoskeletal conditions like osteoporosis, low back pain, driven by the population growth and the aging. Since age is a commonest risk factor for the musculoskeletal condition, it is estimated by 2050 there will be 5 times rise in the people above 40 years living in developing countries, contrasting the wealthier countries. Additionally, the obesity, another important risk factor for many of the musculoskeletal conditions, they also hypothesized to rise dramatically in developing world over the coming 2 decades. Furthermore, increased use of the motor vehicles and the lack of physical activities is also one of the condition which reduces the physical activity, but also it increases the number of the motor vehicle accidents and resulting in the musculoskeletal trauma, accidents, fracture, and many related diseases. Now, what is the role of physical inactivity and the sedentary behavior in a musculoskeletal system? This is a really very good point or the very good topic for the discussion between the young people. Sustained and the systemic urbanization in the developed countries have led to the sedentary behavior. We have lost of physical activities in most of the senses. Outdoor activities has been reduced. We have gone through the pandemic crisis in the COVID period, and we understood that we have lost our physical work or outdoor activities. Most of the work is happening through the home, and children's, they are not going to outside play. They are not doing physical exercises. The gymnastic activities, they are reduced. The sports activities are reduced to avoid the crowd. So because of these all changes in last 2 years, the rapid growth of the video games, social media, movie streaming, they are all the prime contributors to the sedentary lifestyle. And this actually surge in the sedentary behavior is not only a major risk factor for many chronic conditions, but this is also recognized as a substantial global economic burden. Increasing physical activity and optimizing exercises by as recommended by the Arthritis Research Group of UK and the WHO, World Health Organization, is an optimal way to improve the musculoskeletal health. Evidence they show that the effect of the sedentary lifestyle, it can be reduced by the small amount of the activity every day. Recent meta-analysis, they utilizes the data of more than 1 billion individuals concluded that 1 hour of the moderate level activity daily can eliminate the risk of death associated with 8 hours of sitting. So this is a very important conclusion of a big study. Thus, a moderate level of the physical activity is a key requirement of a healthy aging and sustaining musculoskeletal health. Sedentary behavior is a major contributor to the obesity, type 2 diabetes mellitus, which is called a slow poison, which creates many chronic problems over the period of time. And in the long duration, if the disease are not controlled, they becomes a major contributor to the development and the progression of the osteoarthritis, with the several epidemiological studies confirming the link between obesity and the joint degeneration. Evidence suggests that increasing the level of the physical activity will not only increase the musculoskeletal health, but it also decreases the risk of suffering from the obesity-related diseases like diabetes, hypertension, cardiac diseases, which we have discussed. Now, what is the WHO recommendation on the physical activity for the healthy individual? WHO said nearly 2 hours per week of the moderate physical activity, or in a day, 20 minutes of the good workout. Any kind of physical activity like brisk walking, it is recommended. Cycling, running, jumping, Zumba, dancing, 20 minutes in a day is sufficient for a healthy life to avoid the orthopedic issues. These exercises elevates the heart rate and known to be associated with the lower lifetime risk of the cardiovascular diseases. Apart from rendering the musculoskeletal health benefits, improvement in cardiorespiratory fitness can be achieved by changing the sedentary behavior to achieve a low intensity physical activity like walking. Exercise is now widely prescribed for the rehabilitation of musculoskeletal injuries, and its preventive health measure is now widely investigated with the guideline around the type, frequency, and the duration of the activity being considered. Now, what is the focus on evidence-based intervention for the musculoskeletal condition that cause a disability-adjusted life years, which is called daily score. So, low back pain and the neck pain can be benefited by active, staying active and doing a regular exercises. The group exercising program or the weight loss support, if required, can be considered. To reduce the incidence of the fall, balance, strength training of musculoskeletal exercises, home hazard assessment, participation in fall prevention program, getting involved in the activities like gardening, dancing, etc. They are helpful. Osteoarthritis has been shown to be benefited from these activities and exercises that improve the muscle and the aerobic fitness like walking, swimming, pilates, etc. Weight loss, it is very important to avoid osteoarthritis and its manifestation in early age group. Now, the another thing is, how can you explain the association between healthy aging and a physical exercise? So aging is inevitable episode. I mean, you cannot stop the aging, but it can be made easy and healthy with the help of exercise. Exercise renders many benefits to the aging body, included it reduces the manifestation of the aging, especially in the aging phenotype of the elderly. A recent systematic review published in a big journal, they concluded that a physical exercise render a positive impact on the muscle mass function of in the healthy subjects age 60 years and above, and by improving muscle performance, by increasing the ratio of type 1 or the type 2 muscle fiber and increasing the cross-sectional area of the type 2 fibers. A European Society for Clinical and the Economical Aspects of Osteoporosis, Osteoarthritis, Musculoskeletal Diseases, the task force recommended higher protein intake in combination with the physical exercise in the postmenopausal women who are at high risk of developing a postmenopausal related diseases like osteoporosis and the related fractures. Postmenopausal osteoporosis is again one of the very painful conditions in some patients, and they are more prone to get a fragility fractures. Physical exercise program to improve the strength and the balance in aging women with osteoporosis. Additionally, it reduces the risk of fragility fracture. Exercise not only increases the bone mineral density, but it also reduces the inflammatory markers and it improves the muscle function also. So, active lifestyle from the early and the following recommendation for the exercise could be beneficial for the woman. Furthermore, the exercise and the mechanical loading also have a positive impact on the molecular, cellular, and the tissue level. Physical exercise and the mechanical loading also have a positive role in maintaining the cartilage and bone health. Moderate exercise could also enhance the quality of the tissue produced during the healing of the injured tendons. Now, what is the relationship between the obesity and a musculoskeletal disease? A surge in the sedentary behavior, unhealthy diets have caused a global obesity epidemic, along with a sharp rise in the incidence of the type 2 diabetes. These are further great risk factor for the cardiovascular and the neurodegenerative diseases, which further complicates the management of the musculoskeletal diseases. Obesity is an important comorbidities for of many musculoskeletal conditions and is closely observed to the development of osteoarthritis, which is one of the commonest health issues we have discussed earlier also. So, interestingly, the obesity is one of the the most modifiable factor, which can be easily modified control for the osteoarthritis, because age is non-modifiable factor. Some genetic predisposition is a non-modifiable structure, but obesity is one of the most modifiable risk factors. Exercise and the weight loss has benefited the overweight and obese adults with the knee osteoarthritis in many studies, and thus the combination of the widest or the modest weight loss and moderate exercises can reduces the best overall improvement in symptoms of the pain and the joint function. Now, what are the consequences of the childhood obesity and the physical inactivity? This is again a very good topic for the discussion. Lack of the physical activity in the childhood causes the obesity, which increases the musculoskeletal pain as in the adults. Thus, reducing the obesity in the children by encouraging the physical activity, good diet control, good protein supplements, good muscular exercises, they reduces the risk of developing musculoskeletal pain and related disorders. Furthermore, the consumption of the unhealthy diets and the sedentary lifestyle is again a contributing factor for the increased incidence of the childhood obesity. Low in the nutritional value and high in the caloric food. We have seen in today's conditions when the people are at home, when the children are not going for the outdoor activities, they're consuming more caloric diet, more protein, more carbohydrates, and more fat diet. They contribute to the obesity, and which may also play a role in high prevalence of the type 2 diabetes and the cardiovascular diseases in these early age group, and which are further exacerbated by a lack of fitness and physical inactivity. Now, the last topic is a diet also part of healthy living? How does it affect the musculoskeletal health? So yes, it is. Diet is inevitably an important part of the healthy living. A 3-year follow-up study, including 400 adults, has shown that the diet rich in potassium, like from fruits, green vegetables, they reduced amount of the muscle loss in adults for more than 65 years. So this is a very good study. Dietary flavonoids intakes from the fruits and the vegetables are known to have a positive correlation with the good bone health. They improve the bone mineral density, they improve the muscle density, they improve the bone, reduces the bone resorption in perimenopausal women. Reducing the diet of osteoarthritis, improving the diet of osteoarthritis has been shown to have a great benefits. Vitamin D, calcium, particularly protein consumption, they are all important to optimize the muscle, bone, and the functional outcome in older people, reducing the fall and the fractures. Calcium and the protein synergistically optimize the bone health. Thus, dietary strategy for improving the musculoskeletal condition should include the consumption of long chain fatty acid, vitamin D, vitamin K, which are helpful in the bone as well as the cartilage mineralization and decreasing the blood cholesterol. Antioxidants rich diet, they are also important in the athletes by improving the tissue repair function, like vitamin C and vitamin D. Sarcopenia in elderly patients, they can be benefited by a combination of exercises and good dietary supplements of whey protein fortified with vitamin D, as it increases the muscle mass and the strength. Thank you so much for this opportunity, and I think it's a very good topic for the general awareness to avoid the musculoskeletal problems in childhood, adults, and the elderly patients. And I think this kind of awareness will definitely put a positive impact on the people who are unaware about these conditions. Thank you so much.